This is Kellogg Community College Physical Therapist Assistant Program, and we're doing a video on sterile technique. For this video, we're going to be kind of doing a little bit of role playing at times. Normally I would just have the patient sitting in front of me, but in order for the audience to be able to see, I'm going to have her come in once in a while in order to get the patient into the area. Before I start with the patient, I would be cleaning off, sanitizing my desktop, the top that I'm going to be setting my items onto, so I'm going to say that's all cleaned off. I have two large bags. I have one set up that's going to be for my trash, which will be paper and disposable items. The other one would be set up for linens, which I have very few linens that I need for this particular item. Okay, the first thing we'll be doing is taking off a dressing for the patient. So in order to do that, I only need 3 items. Okay, this is a clean technique rather than sterile technique for removing it. So I need my clean gown. I need my gloves. Now normally you're not going to need a mask for this, but for this checkoff we're going to have the students put on a mask so that we can assess their ability to put the mask on and off. Okay, so we are going to have a mask. Normally in clinic you wouldn't need that for this activity. Okay, so first thing I'm going to do is make sure I have items that I need for this part of it, which is, again, the gown, the gloves, the mask. Put my gown on. I can touch the 1-inch border at the neck. Let it drop down a little bit. Pull that on if I need to. I can touch outside to outside. Get those in position. At the 1-inch border, I can find my strings. Get that tied. Just a trick of the trade, something that makes it a little easier for later. If you make small bows and long ties, long tails, it's a lot easier to find it later. So try not to make real big bows, the loop part. Okay, I'm going to reach down as far as I can to reach those so that the part that I'm touching isn't in the front after I'm done. Okay. I'll crisscross this as much as I can. Some gowns do this better than others, but I want to cover up as much of my clothing in the back as possible. And then I'm going to tie that up. Okay. Now if you think about the common sense way, I have to put my mask on next before I put my gloves on, because it'd be hard to put the mask on with gloves. So the mask, I'm going to find the little metal stay, which is on this end. That's going to go across my nose. Usually the colorful part is on the outside. So I'm going to lean forward so that these aren't on the front of my gown here. Lean forward, put that against the bridge of my nose. Tie the top loop. And you want it pretty tight. The bottom one, make sure it comes underneath your chin and then up overhead. Okay. Now you can tie it up overhead. This is one option. The other option is to tie this one straight back behind your neck. Either way is fine. Okay, whichever you're most comfortable with is fine. Okay. Again, if you do small loops and long tails, it's going to be easier to find later, so I just dropped it. Okay, now before I put my gloves on, this is my last chance to get this down out of my eyes, so I want to have it tight against my nose, down out of my eyes as much as possible. Then I can put on my gloves. These are clean gloves, so I can touch the outside of those, no problem. When I put them on, I want to put them up as much as I can over the sleeve, the cuff of the sleeve. So kind of stretch it out and put it up over the sleeve. We're going to pretend that didn't just break. Okay? And then put the other one on. And again, when it's clean, you can touch inside, outside, wherever you need to touch. Stretch it over the sleeve. These aren't staying very well on these particular sleeves, but you want to try to get that over as much as possible so you don't have the hairs on your arm and things like that being able to drop off onto the patient. Okay, once I have this done, my patient again would be sitting here. I'm going to have Sarah come in so I can do this. She's going to have the gauze bandage on. To take that off, I can just take it and pull. Usually I want to go with the hair on the arm if at all possible. It's going to be even more comfortable for the patient if she pulls away instead of me. She can control it that way. So I'm going to hold here. I'm going to have you pull down and pull that right off. So just pull this arm down. There you go. Okay, so that's a nice way of taking it off where the patient controls how fast it goes off. Okay, so then I would look at this, see what kind of pus or blood or whatever happens to be on it so that I can document that later. Okay, and then I'm going to put that right into my trash. Okay. The patient then for this checkoff will be putting into the whirlpool. So I would help her while I still have my gloves on. I would help her arm down into the whirlpool. Okay. Once she's done that, everything is considered contaminated. So now what I tell the students in class is pretend that you have blood or snot or something on the outside, something contaminated that you don't want to touch. Okay. So to take these off, I'm going to grab kind of at the heel of my hand, pull one off. I need to get underneath this one. The cuff is kind of in the way, so I can use one cuff against the other in order to get underneath and pull that right off. Okay, and then I have this nice little package that I can just throw away. What I'm touching was the inside of the glove, so I'm not contaminating myself. Okay, the next thing that's going to come off is my gown. So I'm going to reach behind, untie. If you can kind of pull it away from your body a little, that's going to be easier. Try as much as possible not to touch your hair, so make sure you're going for the lower set of ties here. Okay. You can pull that slightly off your shoulders. Again, that's going to be helpful. If it's billowing up like that, again, you can kind of pull this down a little so that you can reach in there and just touch the inside of the sleeve. Okay, when I go to pull the other one off, I want to try to get it away from my skin as much as possible, so I can kind of pull it down, okay, and then get a place that's fairly close. What I don't want to do is grab here and have the whole sleeve turn inside out. That would be contaminating myself. So I'm using my hand inside the sleeve, getting it fairly close, and then just kind of working my hand out so it doesn't turn inside out. Okay. Once I take this off, what was the outside, I'm going to roll to the inside. As I roll it up, I want to make sure it's away from my body. Okay. And then that whole package goes into my linens. Okay. At this point, I need to wash my hands. There's usually not a sink right in this area, so I would have to leave the room probably to wash my hands. So I would wash my hands, then I can touch my hair and do things where I'm taking off the mask. Okay. In order to put the mask into the linen or the trash bag, it's easiest if you can put it the long way, kind of pull it gently that way. Put it the long way and then it'll go into your bag a lot easier. Okay, for the second part of this, now the patient's going to be coming out of the whirlpool. We're going to assume that her arm is already out. It's air drying, waiting for me to get everything ready. So I washed my hands before I came into the room. Okay, it'll be just a few minutes while I get things kind of set up here. I need to make sure I have all my items. First of all, again, I've sanitized the top of the table. I need to make sure that I have my sterile field, which is inside this container. There's 3 items that will be on top of the sterile field. So I have my tongue depressor, my gauze roll, and my 4x4, which is in the paper container. I'll have 2 packages outside or off to the side. And that's going to be my Vaseline gauze and my sponge that's in the tub. Okay, and then 2 containers. One's going to be a jar, one's going to be a bottle. Okay, so I need to make sure I have all that stuff available. Okay. This time, we're going to take a little quick time out here because I have to fold my gown. I should have got another one. As I'm getting those items ready, I need to check them for sterility to make sure that it's sterile. I'm going to be looking for 4 things. One thing is to make sure that the date has not expired if it's something that is dated. I'm going to look for a chemical indicator such as a dot that changes colors when it was sterilized. I'm going to look and see if it's wet or watermarked. If it's in a paper container like this, if there's watermarks, I'm going to assume it's not sterile. So I'm looking for that. And then the final thing is to make sure it's not punctured or open previously. Okay, so all those 4 things, you need to check each of the packages to be sure that they are showing sterility before we get started. Okay, so now I'm ready for the second part of the checkoff here. Okay. Now, if this was truly a sterile gown, it would come in packaging that you would have to undo the flaps as you went. For the checkoff, we're just going to be having it on the table this way. Okay. So the items that I need for this, as far as the personal protection equipment, I need my gown. Again, I'm going to use the mask only for the sake of practice, taking it on and off, and for the faculty to check and make sure that you're doing it properly. And then we're going to need sterile gloves. Okay, so I have my 3 items there. Okay, so I've checked to make sure I have everything available. And I do. First thing I'll do is put my gown back on. Again, you can reach and touch the inside of the sleeve. You cannot touch, shouldn't be touching the outside of the sleeve. Okay, you can follow that neckline because the 1-inch border is considered contaminated anyhow, so it's okay to touch there. And you're going to sit and watch me while I struggle to tie. Make sure that it's overlapped in the back again. Again, that keeps any contaminants off your clothing before you go to see your next patient. Okay, once I get this on, I'm going to get my sterile field set up. To set up the sterile field, okay, I'm going to start with this packaging. What we've done here is we're saying that this was something that went through the sterilization process. It probably has some kind of an expiration date or a chemical marker on it there, so I would check all those. To do the check off, we want you to break the tape. Okay. And then you're going to palpate and find in there where the cloth is inside. Go about 1 inch up from that and tear about 1 inch into the bag. On the other side, you're going to palpate, go up about 1 inch, tear in about 1 inch. Make sure you have a good hole and gently pull that off. Okay. As you get done with things, throw them away right away. Don't put them down where they're in your way. Inside, the cloth should be set up so that there's one corner of it that's sticking out. So I'm going to grab that corner. Okay. And then I can just pull the paper away and let the cloth drop. Okay. Okay. As I hold this, I want you to see how I'm holding it. My arm is out this way. I'm not over the top of it. My arm is out this way, so there's less chance of things falling off my hand onto the drape. There we go. Okay, so now I want to put my sterile field down. I'm going to take it, put it on the far side, and pull it toward me. Okay. Anything along that 1 inch border around it is considered contaminated. So as I put things onto it, I need to avoid that 1 inch border. That also means that if I don't have it exactly where I want, I can touch it on that 1 inch border to move it wherever I need it on that table. Okay, I'm going to put 3 items onto the sterile field. Okay, so for the tongue depressor, one end will say peel or open. Okay, so you're going to start there. Peel it down about 1/3 of the way. Okay, then go down to where you're just barely onto the wood part. Peel the rest of this down like a banana. Okay, if it breaks off like that, just go to the opposite side, pull it down, and then keep peeling until it's way down there. Okay? Anything that's left over, put into your hand. Again, we're trying to protect these so that you can reuse these to practice. Okay? And then I'm going to reach straight in, drop it down, straight back out. That area that I've reached over now, I can't put any of my other sterile items onto. Okay, so I need to make sure that I know where I've reached over. Okay, that goes into the garbage. Next thing I'll put on is my gauze roll. I will open it up. Again, there's nice little lips here to hang on to. So I'll open up the gauze roll a little bit, most of the way. Okay. Then get a really good hold on that, because this roll likes to do silly things. Okay. So make sure you have a good hold. In clinic, you'll be able to pull that right off. When you're practicing for the checkoff, you're going to need to, again, save that for practicing again. So we're going to take it and just fold it back and get a good hold on it with your fingers before you let go so it doesn't flop back up. Okay, I'm going to go straight back in, fairly close. Okay, drop it out. Make sure it's not connected to your wrapping before you pull back away. Sometimes the actual gauze will catch up in the paper. Okay, throw that away. Then I have the 4x4 gauze that's in the paper packaging. I need to look and see. It's closest to this corner right now. So I'm going to take it down kind of low, shake it so it's about as low down there as I can get it. I don't want you up here shaking it really hard because we don't want air currents around our sterile field. So that's why you're holding it low. Okay. If I've got it down into that corner as far as I can, I'm going to turn this so that I can get to it. Feel for the material in there and go down about an inch. Tear into the paper. Okay, again about an inch, tear into the paper. That's going to give you a nice handle. So then you're going to slowly pull down this direction and then pull up this direction and then carefully pull that off. Again, notice how I'm holding it out away from me. I don't have my hand over the top of it. And definitely don't pull it this way because then it can fall onto your hand. Okay, so when you pull it so that your hand is in this position. Okay, I'm going to take that in. Put it on my field. It's okay if that touches the gauze because both of those are sterile items. Sterile can touch sterile. Okay. Each time when I did that, I made sure that my hand did not go over any of the sterile items. Okay, next item I'm going to do is I will do my the one that's in the tub here, the sterile sponge. Again, you kind of break open the corners here, loosen up the top, and with this one you want to grasp along the whole top of it. You don't want to just grab in the middle, and then you're going to pull it open like that. In clinic, again, you can pull that top right off, but you're going to want to practice with this, so we're going to have you leave it on. Just tuck it right underneath, and you can slide that along your table, and it's all set. For this, we're going to be doing a wet to dry dressing, which you don't see in clinic as much anymore. We're still going to show you how to do it in case that comes back into vogue. You need to know that. So for the wet to dry, I'm going to use, we have fake saline here. So what I'll do is I will open the top of it. I need to do what's called lipping it. When I lip it, can you bring that basket over here? When I lip it, you can assume that there may be a little bit of crustiness, right there, crustiness along the lip. So what I'm going to do is I want to wash any crustiness off. So the sterile fluid that goes out of it, as I'm going over the top of a wastebasket here, I'm going to start it on one side. I'm going to pour it out so that it goes right over and kind of cascades over that lip. That same lip now is what I'm going to use to pour the sterile fluid into the sterile container. Okay, so I'm going to pour in some fluid, come straight back out, put the lid on, and get that right out of my way. When you're practicing, if you want to just leave the lid on and pretend to lip it, that's fine so that you don't have wet stuff in your bag when you're storing it. Okay, another item I need to get ready is the Vaseline gauze. And with this one, I'm going to open the corners. Maybe. Well, I'll just go straight across. I'll open across the top. Okay. Once I have it open about that far, this is another one that you want to make sure you have your whole thumb across it that way. Because if you try to open it with just your fingertips, it's going to get all sorts of kinks in it, and it's going to make it very difficult. So thumb across the part that they have set there for you for handles. Open it up so it's nice and flat. Now, even in clinic, you do not want to rip the top off of this one because then it'll curl up on you. So get it nice and flat, put it down on the table, and then you can adjust it wherever you want it. Okay, so that's all ready to go. So I have 3 items on the sterile field, 2 of them off to the side. I'm going to need Silvadene for this also. So I'm going to prepare this by just opening the lid, taking the lid all the way off, and then just resting the lid on it so it's ready for me in a few minutes. Okay. Sterile gloves, I'm just going to get them ready right now. I'm not going to put them on yet, but I can take them outside or out of the outside packaging. Okay. My other packaging, I can use either table. I'll use this table over here. And I can just get that somewhat opened right now. I don't need to open it where any glove is showing yet. Okay, so I'm going to double check myself before I move on. The next thing I'll do is put on my mask. Now again, for a real patient, you wouldn't need a mask to do a dressing change in most instances. We're doing that for this checkoff so that you can get a feel for putting it on and off, and we can assess you for that. Okay, so everything is here. I'm going to again put my mask on. When you put the mask on, be sure it comes away underneath your chin before you do the second set of ties. Okay. Now for this checkoff, we're having you do a lot of layers of items that you're putting onto the patient. Normally, you would not be putting all of these things onto one patient. We wanted you to practice with a number of different types of packages. So that's why we're doing the Vaseline gauze and a wet to dry and a roll and a tongue depressor. You may not have that, or you probably won't have that for most patients where you have everything. Okay, so this is my last chance to make sure this is down out of my eyes. So I've got everything ready to go. For this one, we're going to be putting some Silvadene, some fake Silvadene onto the patient's wound first. So in order to do that, I need to have one glove off, so I'm going to put one of my sterile gloves on, and it should be on my dominant hand. Okay. So when I do this, I'm going to open it up like a book. Can you see okay? Okay. I'm going to crease it on the far side, again, making sure I'm not leaning over it. Crease it near me. As I go to get my glove out, I don't need to open both sides. Don't worry about opening both sides. I'm going to put it on my dominant hand, so I'm going to use the little flap that they give you here to open that up. That way, even if I have the flap up here, if it falls back onto the gloves, I haven't contaminated everything. Okay? If you do it the wrong way, a lot of people do this and then they try to hold it open. Once you touch that, if it flaps back over, it's going to be contaminated. So don't do that. Use those nice little handles that they give you there. Okay, so I open it up. I grab the glove by the cuff that's already folded. It'll come that way. Get it on as far as you can before you let go. Okay, and then when I let go, it's still folded over. I can grab that last little bit of cuff and pull it up really nice. I haven't touched any of the sleeve. I've only touched what would have been the inside of the glove. Okay. For the next part of this, what we're going to do is take the lid off of the Silvadene and use the tongue depressor to put that on the patient. Okay. So I'll have my patient come back over for a second. I'm going to lift the lid up. Again, I don't want to set that lid down. If for some reason I have to, I need to make sure that it's face up so the inside of it is up when I set it down. Our preference is that you don't even set it down. You shouldn't need to. Okay, I'm going to reach in, get my tongue depressor, reach for the cream that's in the middle of the jar. Try not to touch the edges or the bottom. And I can put that lid right back on, get it out of my way. Okay. Patient's wound is on her forearm here, so I would take this and put it on. If I needed more, I could leave the jar out, so it depends on how much I need. Gently put that into the wound. Okay, then I would get rid of my tongue depressor. Okay, before I go on, I'll go ahead and put my other glove on. Okay, so I'm, again, with my non-dominant hand, I can touch the packaging, so I'll open the packaging, making sure I don't touch anything that I've touched with my bare hands. I'm going to come in here, kind of hook my fingers into the cuff, slide this one on. Okay, again, don't let go of it until you absolutely have to. That looks pretty good, so now I'll let go. Can you see how my finger got stuck there? That's okay because I can touch outside to outside on these sterile gloves. So once I have both of them on, I can do that, the fixing. Looks like everything's covered all the way around, so we're good. Okay. Again, you wouldn't necessarily put all of these on a patient. Next thing we're going to put on is the gauze, the Vaseline gauze. I want to make sure I'm not reaching over, because remember before I had my hands behind me. These sleeves have been behind me to tie, so I don't want to reach those over the other items. I'm going to put my sterile glove in the middle of this package, pull off the gauze, okay. And then I'm going to put this, it's just Vaseline, is that okay in your arm? And I'm just going to set it on her. I'm not going to press it on at all. Okay? We're doing, after that, a wet to dry dressing. So what we're going to do is we're going to reach just the top one or two. Okay, and it's very wet, so you're going to wring it out. Okay, making sure that you're not over your other sterile field. Okay, and then whatever shape you need it in, you can put it. So if you need a longer one, you can stretch it out more. Then you're going to put that on the patient. Again, just set it on, don't press it on. After that, we'll put the dry one on. Okay, and at this point, the wound is covered, so it becomes clean technique rather than sterile. So I'm going to use the gauze roll to attach this. So now it doesn't matter if I touch her skin, because it's clean rather than sterile technique. The wound is covered. You want to have this firm enough that it isn't going to slide around the arm, but obviously you don't want it to cut off circulation either. Okay, so I would put that all the way onto the patient, all the way around, okay? I'll let you go ahead and take that. So then I can send the patient away. She's all set to go. I need to clean up after myself. Okay? As I'm taking care of things, I want you to picture this as contaminated salt everywhere, okay? So all of these things, I want you to picture that there's salt on it, and that salt has nastiness, okay? So what I'm going to do, I'll start over here. Any papers or anything that's open, I need to fold in on itself. So any salt that's on it will be contained on the inside. So again, if you just picture that as salt, that's a good way to keep track. You don't want to pick it up and drop the salt all over, okay? All right, that one goes into the garbage. And my sterile packaging here, again, I'm going to fold it all up before I leave the table. Okay, this one is linen, so everything's the same, except now, after I fold it up, I'll put this one into the linen bag. Okay. Double check, I don't want to touch the jar yet because I still have contaminated gloves on. Okay, so it looks like everything's taken care of. Kind of check around. First thing I need to do is take off my gloves. So there's one glove off. Okay, again, you're just trying to get underneath. Pull that one off. And then I'll take off my gown. Again, try to reach for that lowest set of ties there. When I go, again, if this is bloused up like that, I can use one hand to pull it down a little bit. Okay, and then that I can use to pull down. Okay. All right. At some point before I get done, I need to go ahead and take care of the jar, so I'll go ahead and make sure those are all closed up. Before I do my mask, I need to wash my hands, and then I'll take my mask off. Before I do my final hand washing, I want to make sure I take my trash bag, put that into the red biohazard bag and mark it as trash. Take my linen bag, put that into the red biohazard bag, mark it as linen, and then the last thing I'll do is wash my hands. And that's it.